Have you ever wondered how something you cannot feel, cannot see, and cannot hear could quietly be shaping your future every single day? Deep within your body, your kidneys are working tirelessly, filtering, balancing, protecting your life in silence. Yet, for those living with chronic kidney disease, this silent work becomes a delicate balance between stability and risk, between control and uncertainty. Many people assume that if they feel fine, everything must be fine. But the truth is far more complex. Chronic kidney disease does not always announce its presence with pain or obvious symptoms. It progresses quietly, often unnoticed, until it reaches a point where the consequences are much harder to reverse. This is why understanding how often to monitor your condition is not just a medical recommendation, but a powerful act of self-awareness and responsibility. It is not about fear, but about staying informed and prepared. The idea of regular blood and urine testing may seem routine, even repetitive. But behind each test lies critical information about your health, your progress, and your future. Each result is like a message from within, telling you whether your current path is leading towards stability or decline. In the teachings and insights inspired by Dr. Mathew R. Weir, there is a consistent emphasis on the importance of paying attention to these signals early, before they transform into irreversible complications. He highlights that monitoring is not merely about numbers on a report, but about understanding the story those numbers tell. When you begin to see your health as a journey rather than a fixed state, these tests become checkpoints that guide you forward. For someone newly diagnosed, the idea of frequent testing can feel overwhelming, even intimidating. Questions arise. How often is enough? How much is too much? And what do all these results truly mean? But the reality is that the frequency of testing is not random. It is carefully aligned with the stage of the disease, the rate of progression, and the individual's overall condition. Early stages may require less frequent monitoring, offering a sense of stability, while advanced stages demand closer attention, reflecting the increased need for precision and care. This variation is not a burden, but a tailored approach designed to protect and empower. Imagine navigating a long journey without checking your direction or fuel level. Eventually, you would lose your way or face unexpected breakdowns. Similarly, without regular monitoring, chronic kidney disease can advance without warning, leaving little room for timely intervention. Blood tests reveal how well your kidneys are filtering waste, while urine tests uncover hidden signs, such as protein leakage, which can indicate damage long before symptoms appear. Together, they form a comprehensive picture, a map that helps you and your healthcare provider make informed decisions. But beyond the clinical perspective, there is a deeper message here, one of awareness, discipline, and proactive living. Taking control of your health is not about reacting to problems after they arise. It is about anticipating them, understanding them, and addressing them before they take hold. This mindset transforms fear into confidence, uncertainty into clarity. As you continue on this journey, remember that knowledge is not just power, it is protection. And in the quiet rhythm of regular testing, there is a profound opportunity to stay one step ahead, to listen to your body's silent signals, and to shape your future with intention and care. There comes a moment in every health journey when routine begins to feel like repetition, when the regularity of tests and checkups starts to blur into the background, and it becomes tempting to believe that nothing is really changing. This is where the true challenge begins, not in the diagnosis itself, but in the discipline of consistency. Because chronic kidney disease does not move in dramatic leaps that you can easily notice, it shifts quietly, almost imperceptibly, and this is what makes it dangerous. You may go weeks or even months feeling stable, reassured by the absence of discomfort, only to discover through a simple test that something has changed beneath the surface. This hidden progression is what makes monitoring so critical, and it is exactly what Dr. Mathew R. Weir that continually emphasizes in his approach to kidney health. He teaches that the absence of symptoms is not a guarantee of stability, and that real control comes from awareness, not assumption. Imagine standing at the edge of a calm ocean, the surface smooth and peaceful, giving no indication of the powerful currents moving beneath. Chronic kidney disease behaves in much the same way, and without regular testing, those unseen currents can carry you further away from stability without any warning at all. This is where suspense enters the journey, not as fear, but as a quiet realization that what you cannot see still matters deeply. Every blood test result, every urine analysis becomes a moment of truth, a reveal of what has been happening behind the scenes. Sometimes the results bring reassurance, confirming that your efforts are working and your condition is stable. Other times, they uncover subtle changes, small shifts that signal the need for adjustment, perhaps in medication, diet, or lifestyle. These moments can feel unsettling, even discouraging, but they are also opportunities, chances to act before the situation becomes irreversible. The real danger lies not in discovering a problem, but in missing the chance to discover it early. And this is why the timing of these tests is so important. It is not about testing more for the sake of doing more, but about testing wisely, based on your stage and your individual needs. In earlier stages, your body may still compensate effectively, requiring less frequent checks, giving you space to build strong habits and maintain balance. But as the condition progresses, the margin for error becomes smaller, and the need for closer monitoring increases. This shift can feel overwhelming, as if the condition is demanding more of your attention, more of your time, more of your energy. Yet, this increased attention is not a burden, it is a form of protection, a way of staying ahead of potential complications. The suspense in this journey is not about waiting for something bad to happen, but about understanding that every moment holds the potential for change, and that your awareness can influence the outcome. When you begin to see monitoring as a form of empowerment rather than obligation, everything starts to shift. You are no longer passively waiting for results. You are actively engaging with your health, learning from it, adapting to it. The numbers on a report stop being abstract figures and start becoming meaningful signals, guiding your decisions and shaping your path forward. This is the deeper lesson that emerges from the teachings inspired by Dr. Mathew R. Weir, that true control is not about eliminating uncertainty, but about responding to it with knowledge and intention. And as you continue this journey, you start to realize that each test is not just a measurement, but a message, a reminder that your health is dynamic, constantly evolving, and that staying informed is the key to navigating it with confidence and resilience. As you move forward in this journey, something begins to shift within you, something deeper than routine, stronger than fear, and far more powerful than uncertainty. You start to understand that managing chronic kidney disease is not just about responding to test results, but about developing a mindset rooted in awareness, patience, and long-term commitment. The frequency of your blood and urine tests is no longer just a schedule you follow. It becomes a rhythm that aligns you with your own health, a steady reminder that your future is being shaped by the choices you make today. There is a quiet strength in showing up consistently, in choosing to know rather than to guess, in facing the truth even when it feels uncomfortable. This is where true empowerment begins. Inspired by the philosophy of Dr. Mathew R. Weir, you come to realize that knowledge is not something to fear, but something to embrace. Because every piece of information brings you closer to control, clarity, and confidence. Over time, the numbers on your reports begin to tell a story that you can understand, a story of progress, of stability, or sometimes of warning, but always of opportunity. And with that understanding, you gain the ability to act, to adjust, to protect what matters most. There will be moments when the journey feels heavy, when the repetition of testing feels exhausting, and when the uncertainty feels overwhelming. In those moments, it is important to remember why you started, to remind yourself that every test is a step toward prevention. Every check is a chance to avoid something far more difficult down the road. This is not just about managing a condition, it is about preserving your quality of life, your independence, and your future. The power of early detection cannot be overstated, because it transforms what could have been a crisis into something manageable, something controllable. And this is the true essence of proactive health, not waiting for symptoms to dictate your actions, but using information to stay ahead, to remain in control, even when the path feels uncertain. As your understanding deepens, you begin to see that this journey is not defined by limitations, but by possibilities, by the ability to make informed decisions that shape a better outcome. The discipline you build through regular monitoring extends beyond your health, influencing how you approach challenges, how you handle uncertainty, and how you commit to long-term goals. It teaches you resilience, patience, and the importance of consistency in every area of life. And in this process, you are not just managing a condition, you are becoming stronger, more aware, and more intentional in everything you do. So as you reflect on what you have learned, remember that you are not powerless in this journey. You have the tools, the knowledge, and the ability to take control, one test, one decision, one step at a time. Let this be your motivation to stay consistent, to stay informed, and to stay committed to your health, because your future is worth that effort. If you are benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.